Opiate dependence is defined as tolerance and dependence to opiate. Basically, you take opiate, you feel good, you take more, you feel good again, and you keep taking more and more. So your tolerance increases. But now when you try to stop using, because it interferes with your life, you find out that you're having a lot of symptoms. And tolerance and dependence become the real definition of what opioid dependence is. The cause of opiate dependence is the same as any other addiction: genetic, environmental, peer, social. Obviously, certain opiates are illicit, therefore it's a crime to get it. So the person who's dependent basically has to use a lot of deception in order to go get it. However, there are opiates that are prescribed by the doctors for management of pain and so on. And these are also abused, and people can become dependent on them. As with all addiction, opiate dependence is a chronic relapsing and can be fatal. And it can be fatal at a quite young age. Many people take overdoses, and part of the reason why this happened is that some people go into treatment, spend a month or two or a year without using, and suddenly relapse, and they think they can use as much as they were using before. Well, their tolerance for the drug has gone down. So if you use a large amount, you can actually overdose and die from it. The only way to prevent opiate dependence is never to use it. Obviously, there are people whose family has very high risk for dependence. And if you know that this is already there in your family, you should avoid these drugs. Now, sometimes you may need an opiate because you've had surgery or you have certain pain. But this should be only for a short period of time, a week, maybe two, and should be stopped after that. One of the common things that you hear talk about within the addiction field is people, places, and things. Usually the same people that you used to associate with, the places that you used to go, and the things that you used to do, you can no longer do these same things. So therefore, you may have to cut off some of your friends. You may have to stop going to certain places, restaurants, bars, and so on, so you can avoid certain environment that might cause craving and might cause you to ultimately start using again.